Leslie, sounds like a horror show. Is this what we're going to have if we have nationalized health care?
No, what I think we need is an education, and let me give you one. I'm married to a doctor. I own a medical center in addition to being a nationally syndicated radio talk show host. So believe me, I don't want that type of universal health care. It would affect directly and specifically my bottom line. But let me tell you something. We're not talking about the program in Great Britain or in Germany or in France. We're talking about a reformation of the current health care plan we have. To even compare Great Britain's national health plan is beyond apples and oranges.
Do you
to
think,
look at we're not nationalizing the hospitals.
Do you think it's
We're not nationalizing the hospitals.
Okay, but do you think it's a right? I mean, the president said very explicitly this week that he believes that health care is a right. Do you share that view?
Do I share that in what's supposed to be and looked up to as the richest, most progressive country in the world?
That's what he said. There we go.
Is it a right that children in this country can die because they don't have proper health care? Absolutely.
Terry, Joyce, here's the thing. This is a huge issue. It's a huge issue, and it's a huge debate. And God love Niall, because I'm with him 100%. But right now, this is not the debate we should be having. These guys need to focus on the economy. This whole notion of shoot now, ask questions later keeps happening, and they're going to screw up national health care if they put a plan out right now, just like they screwed everything else up.
Health care reform is part of the economic problem.
It can't be.
If you reform the health care program, we will help the economy. You have to remember, just look at the facts. One of the problems with this country, and one of the problems with everybody saying the corporates are running the country, let's look to the insurance companies. Let's look how much money they're making.
But if we can bring jobs, it doesn't matter.
Look to the post office. The post office doesn't pay state or federal income taxes. They have a monopoly, and they're broke.
You're going to compare a stamp to somebody who has cancer?
JBL,
you're going to compare delivery of a letter with somebody who has cancer? Okay, let's bring JBL in here. You know, that is one of the arguments that a lot of proponents of national health care make, that this is going to help fix the economy. Yet most CEOs I talk to say numbers 1 through 10 of what needs to be fixed are the big banks.
There's no doubt about it. This health care has nothing to do with the economy being bad right now. It has nothing to do with it being good if it turns around in the near future. It's nothing. It's easy to hold up kids and say cancer, cancer, or say kids are sick, kids are sick. Yeah, I'm against kids being sick. I'm against cancer. I'm against all that stuff. But this is the wrong time to start talking about national health care. We need to fix this economy first. Stay off Jay Leno. Stay off ESPN. Please go to work and fix this economy.
Jonas, though, some people would say the auto companies got into the mess they're in because of their very generous health care benefits.
I would say that, and I would say that if the government picked up more of the benefits, they wouldn't be in the hot water. Then the other European and Japanese automakers have government benefits that are larger than ours. They have less costs. It's actually unfair, in my opinion, for corporate.
But they're not selling cars either.
Well, I don't think they're getting benefits actually from their government too. I don't think the corporation should have to pay for health care. I think it's a flawed system that we have here, and we have a bad economy. Maybe this is a good time for the government to pick up more. I think it should be mandatory, like it is in Massachusetts now, where you have to have health insurance. And if you're below the poverty line, the government kicks in some. But that's a private system with private insurance, private doctors. Just a question of who's picking up the tab. I think the government should get out of insuring wealthier people in the middle. I don't think there should be Medicare.
Oh, so you're going to means test it.
And you pay for it simply by removing the deduction that exists for health insurance, so corporations are paying for it. That's an idiotic system that burdens corporate America with this burden of paying for health insurance.
What about the idea that we're one of the few industrialized countries that actually ties health care to your job? And if you don't have a job, you don't have health care. It's kind of crazy.
Well, I think that's actually a system that works. I mean,
works if you have a job.
It's a market-based system, and the vast majority of Americans are covered through employer-based healthcare systems. Those who are not are covered, of course, by the state. In the United Kingdom, of course, the vast majority of people are covered by a socialist universal healthcare system, which is of a very, very low standard. And each year, hundreds of thousands of British people seek operations abroad simply because the British socialist healthcare system is so bad.
Because they got leeches and operations by candlelight over there doesn't mean that's our system. And if we already have a huge socialized healthcare system through Medicaid and Medicare, and it isn't that bad as the system over there, because it does have an element of private insurance.
Terry, we wouldn't be having this conversation if we focused on the economy and kept people in their jobs. Then we wouldn't have to really worry about anything else. And I'll tell you, this goes with the green event. This goes same for the green agenda. You can't go buy a wind turbine if you can't get credit. So we need to be focusing on one thing at a time. We can't do both. Can we
you're a woman. You don't know how to multitask?
And there are all men in D.C., Leslie, if you haven't noticed. Mostly men in D.C.
That's true, but I do believe with a good woman behind them, they can learn to multitask, and I do believe President Obama has mastered multitasking.
Okay,
we can do more than one thing. He's got 4 years to do it.
All right, he certainly has a lot of time. Thanks, everyone. Thanks to Leslie and Niall for stopping by.